Good afternoon, everyone. I'm Dr. Mark Jeffery from Ulala Cosmetic and Laser Clinic here in Surface Paradise. I'm just between patients, so I thought I'd have a quick talk about threads, and it is by no means an exhaustive talk. It's just to give the client some understanding as to why we use threads. Okay. So threads are made of a material that has very similar to different types of sutures that we use in surgery, and through the manufacturing process some of those threads have cogs, barbs or cones on them, and these allow the thread to provide support in the tissues and also help create an inflammatory response, so we get some stimulation of fibrosis and collagen deposition. The threads are made of different materials, and these go by the name of PDO, PCL and PLLA. The PCL threads last the longest, and we have about 6 registered devices in Australia today. So why do we use threads? Well, threads principally, fundamentally are used for lifting tissues. So in patients that notice that their jowls are heavier, they've got some what we call centrofacial aging and loss of the cheeks, an eyebrow may have drooped, we can use the threads under the neck in those areas along the side wall of the face to position those threads to help create lifting. And some of these techniques require anchoring of the threads, and other techniques we can use free floating techniques. So this is commonly what we use a lot of the time now. The thread is actually in the cannula, and inside the cannula is a device that's actually holding the threads. So when we do threads, what we're really doing is we are pushing the threads down from here in this fashion underneath the skin, so it's very safe. And then because there are cogs, we are able to pull back on that tissue, and that creates lift. Now, PCL threads last about 18 months. The effect in some patients can be 2 to 3 years. Generally speaking, I have not repeated in 5 or 6 years many thread lifts that we've performed here. It's all about selecting the right thread. So that's the side wall of the face. It's easily done. We can put the threads underneath this area to lift the skin of the neck up in the upper third of the neck. And then there's a common procedure being done at the moment called foxy eyes or cat eye, and we can either position the thread at the corner of the eyebrow, and what that will do is simply just one cog thread up here, and then we put a couple of smaller threads across that, and that just helps for some collagen stimulation, and that can last more than a year. Once again, very simple technique. It essentially doesn't involve cutting of the skin, which you would have with a blepharoplasty. You can put some threads through the fine lines here. It's a lot smaller than this. You can put a palm thread or a vine spring in that area, and you can use them with filler as well. We have other devices where you can run from the cheek to lift the marionette up. So threads have become a very important part of our arsenal. I see a lot of patients where really the indication wasn't right, and in a sense they've tried to use fillers and they come back saying, I still have a jowl, I feel like my face is saggy. Commonly what patients will do is they'll come and they'll do this, and they'll say, I want this. You can't achieve that with a filler. Threads are the easiest way to do it, and they are essentially, in my opinion, in expert hands, they are harmless. They're harmless to people. I've had very minimal complications with threads. You can use it commonly in the nose as well, and we have the Korean nose lift, and you can use it in Caucasians. You can change the tip of the nose, so on and so forth. So I have talked about threads before. but I'm just going to close off now and say it really is no different to taking this device, which is used for fillers, which is a needle in here, and passing that needle multiple times. The only difference is what's in the needle is a liquid, and what's in the cannula here, or the cannula there, is a thread. That's the only difference. But biomechanically, they are vastly different. And in some patients, even we mix certain procedures. So you might, for instance, do a thread and some filler, or you might do some chin tightening with radio frequency, or some ultrasound. The combinations are endless, and at the end of the day, if you can get away with something relatively minimally invasive versus a facelift, and you can maintain the integrity of the loose tissue, then without undergoing a major surgical procedure, then over the years you will delay or may not even need to have a surgical facelift. If you have any questions and you'd like to talk more about the threads, I can show you different threads. What I will do is the thread basically goes underneath the skin. There it is. When we pull that off, what happens is the thread stays behind there, and we pull the cannula out to leave this thread. And so what you've got now is you've got a thread that's sitting essentially like that. We move it around, we move it around, we move it around, and the skin, even though they're very tiny threads, is gently pushed back over those cogs, and that creates a lift. These cogs on this device also give beautiful collagen stimulation. You get lightening of the skin. So that's in a nutshell about threads. If you'd like to discuss more about it with me, please don't hesitate to contact the clinic. Thank you.